The following program is brought to you by Caltech.
Good afternoon. I hope everybody has been enjoying a wonderful seminar day and is ready for a fascinating final talk. My name's Hannah Dvorak-Carbone, and I graduated from Caltech with a PhD in neurobiology in 1999. And today I have the pleasure of introducing John O'Doherty, who is a professor of psychology in our Division of Humanities and Social Sciences, and he's also director of the Caltech Brain Imaging Center. Professor O'Doherty got his BA from the University of Dublin and his PhD at Oxford. And if he had been here when I was in grad school, perhaps I would have ended up studying human brains instead of, or in addition to, rat brains for my own PhD. Professor O'Doherty's research focuses on the biology underlying decision-making using a combination of functional magnetic resonance imaging and computational models. I think we're all familiar with the saying, good judgment comes from experience comes from bad judgment, and Professor O'Doherty's talk today will shed some light on how that actually happens in the brain and why it sometimes doesn't. Before we get started, a couple of brief housekeeping notes. We do hope to have time for a few questions after the talk, and so if you do have questions afterwards, there are microphones in the middle two aisles, and if you can come down and use the mics, that'd be much appreciated. And also, since this is the last formal talk of the day, I'd like to remind you to fill out and return your comment cards to help us plan future seminar days. So with that, please join me in welcoming Professor John O'Doherty as he tells us about how the brain learns from the past and makes good decisions for the future, a tour of neural reinforcement learning. John?
Great. Thank you very much, Hannah, for the very kind introduction, and I hope you're enjoying your day so far. So I'm going to tell you a little bit about some of the work that my own research group does here at Caltech. And one of the questions that we're very interested in is kind of problems like this. So imagine that you're out in the woods, you're taking a hike, and suddenly you find the path splits into two. And so the question would be, which path will you take? Okay, so it's a very simple kind of decision, okay? And, a decision could be like this, or it could be a decision about what you want to do for the rest of your life, career moves, or it could be something like what item you'd like to choose off a restaurant menu. So we're interested in the whole gamut of decisions, and we're interested in how the brain learns to make good decisions. So let's go back to this example. So here you can see there's not a lot of information to tell you which route to take, right? So you're kind of under uncertainty when you're making this decision because all of the information is not immediately available for you. But let's say last time you went this way, you got mauled by a bear. Well, probably you'll learn based on trial and error that probably it's better to go this route. Okay, so to some extent, you're relying on past experience to guide your future choices. And this is kind of a problem that we can study in the lab, and this is just an example toy decision-making problem that we use. It's called the N-armed bandit problem, and basically you have here 3 bandits, and so what you can imagine is instead of coming to Caltech, you actually went to Las Vegas for the weekend, okay? And you have 3 slot machines, and what you know is that one of these slot machines pays out more money than the other, but you don't know which. And obviously there's no information on the slot machines that tells you which one pays out the most. So the question is, how would you solve this kind of problem? So before we get to that, I'm just going to give you a brief historical introduction to how people have studied decision-making in the brain in the past. And so one of the earliest examples of looking at brain correlates or brain substrates of decision-making goes back to a very famous case called Phineas Gage. And this was a guy, he was studied by a physician called Harlow in the mid-19th century. And he was a railroad construction worker. And what happened was that, and this now is freezing, I think. Oh, here we go. Okay. What he did was he blasted rock for a living. So effectively, I guess, in order to get the railroad to go through mountainous regions and so on, they had to kind of basically blast their way through. And that was his job. He would drill a hole, he'd fill it with blasting powder, and he would then cover it with sand, and compact it using a thing called a tamping iron. And that's this thing here, which you can see here, this tamping iron. Okay. And on a very famous occasion, in September 13th, 1848, outside the small town of Cavendish in Vermont, he was doing this, and around 4:30 p.m., an explosion blasted the tamping iron through his skull. Okay? And basically what people think happened is that he might have forgotten to put the sand in. Okay? And you can sort of see, this is a picture here, you can see his eye is kind of closed here. So it basically went under his eyeball and went up through his brain. And he survived, and Harlow basically reported on what happened to him after the injury. And what happened was that his behavior changed a lot. So the equilibrium or balance between his intellectual faculties and animal propensities seems to have been destroyed. He is fitful, irreverent, indulging at times in the grossest profanity, and it's noted it wasn't previously his custom. He was manifesting but little deference for his fellows, impatient of restraint or advice when it conflicts with his desires, at times pertinaciously obstinate and capricious and vacillating. And particularly relevant to decision-making, he was devising many plans of future operations, which are no sooner arranged than they are abandoned in turn for others appearing more feasible. So there seems to be some problem that he has generally in his behavior, his social behavior, interacting with others, as well as in making decisions after he had this lesion. And more recently, somebody called Hannah Damasio and her colleagues basically used computer reconstruction techniques to look at the path that this rod took through Phineas Gage's head. And basically, you can see here, it's going through a frontal part of the brain. And the area that seemed to be particularly impacted is a region that collectively can be called the ventromedial prefrontal cortex. So it's this area here. This is looking from the bottom of the brain up. So the eyeballs are basically down here. And this area is called the orbitofrontal cortex, so called because it's above the orbits of the eyes. And then you also have another area called the medial prefrontal cortex, which sits above there. And these two regions together are called the ventromedial prefrontal cortex. And so this gave some suggestion that maybe this area might be relevant for understanding how decision-making happens in the brain. So another task by a guy called Anton Bishara, this is at the University of Iowa, he developed a thing called the Iowa gambling task. So this is basically a way of taking patients that have damage to this part of the brain, here, and bringing them into the laboratory and looking to see whether they have decision-making deficits. And so the task that he used is a very simple one. It's basically a card-playing task, and there are different decks, okay? There are 4 different decks. And basically, if you select a deck, you actually get to win or lose money, okay? And the key thing to this task is that 2 of the decks, if you select from them, you'll lose more money on average than you win, cumulatively over time. Whereas the other 2 decks, if you select from those, you'll tend to win more than you lose. And so if you're solving the task well, you should basically learn over time to select from the decks that cumulatively give you gains compared to losses and avoid the ones that give you cumulative losses. And what he found was that patients, whilst normal controls gradually learn to select and choose from the good decks, patients who have damage to this region of the prefrontal cortex, the ventromedial prefrontal cortex, basically never learned, even over 100 or so trials, to select from the good decks more than the bad decks. So it's as if they had some deficit in decision-making. Okay. So we can then ask a question as, what's happening that leads to this kind of deficit if you have damage to this region. And so we're going to take a slight diversion, and we're going to refer to the notion of utility in economics. So economists study how societies work, how companies work, and of course also how individuals make decisions. And one of the core concepts in economics is that a decision maker makes a decision in order to maximize his or her potential utility. So in other words, how good or bad something is, and what you want to do is you want to make a decision that maximizes the prospect of gaining a benefit and avoiding something that's deleterious to you. And so let's imagine that you had, somehow the brain has this representation of utility for things, and that's what you use to help you make decisions. So how might that work? Well, imagine here that you have choices. So you have an apple, and you have an orange, And so imagine these are the utilities that you have for these things. So basically how good or bad these things or how desirable they are to you. And so what you can see is that the desirability of this apple, the utility is above that of the orange. So that might mean that you would choose the apple over the orange, okay? And if, for example, a hamburger came along, maybe the utility of that might be up here. And maybe you'll choose the hamburger more than you would the other options. Okay, so there's the idea that the brain somehow is trying to maximize utility. That's the notion. Okay, so let's kind of apply this to this bandit problem. So what might be going on? Well, one way that you might solve this problem is by trying to have a representation of the expected utility of each of the possible machines. So in other words, if I choose this green slot machine, how much reward do I expect to get on average for choosing it, okay? And similarly for these other things. And so imagine if I have these utilities that I compute, which I'll call decision utilities, then I can just compare between the utilities of these different slot machines and choose the one that gives me the highest overall utility, which is the highest overall amount of reward. Okay. Now, what will also happen is that as I'm choosing these slot machines, I'll also occasionally win or lose money. So imagine I win $1 on this slot machine. So I also want, if my brain is going to be able to solve this problem, I need to be able to recognize whether something is good or bad, and I need to be able to essentially represent the experience of a positive thing happening to me, as well as something that's aversive happening to me. Okay? So you have these two different signals. You have this decision utility, which is at the time of decision making, how good you think something might be. And then you have this experience utility, which is really how good something is when you actually experience it. So whether you win money or whether you're eating the apple or the hamburger, it's telling you, your brain is telling you how good something is, okay? And so I'm going to talk to you about some work that we've done to look at where these signals are represented in the brain. So let's first look at experience utility. Okay, so how do we actually measure brain signals related to this, to these kinds of variables? Well, one thing you could do is you could open up people's heads and you could stick electrodes in and actually measure neural activity directly. But that's quite invasive, and that's not something we can sort of do every day, okay? Now, it is done sometimes, so if a patient is having surgical treatment for example, epilepsy, and the surgeon is opening up their brain for clinical reasons, you actually can sometimes measure signals there as long as it doesn't interfere with the clinical objectives. So we do occasionally get to do that, and that's actually work that we're also working on in the lab. But most of the time, we can't do that. So how can we actually measure brain activity in people without sort of invasively sticking in electrodes? Well, we can actually make use of certain tricks. And so this is just a representation of a neuron. And the way neurons work is that they generate action potentials, which is basically electrical activity. And neurons communicate to other neurons by releasing chemicals called neurotransmitters. So here is a presynaptic neuron, and basically this is releasing these chemicals into this thing called a synaptic cleft, and it's basically binding with this postsynaptic neuron, and then in turn generating action potentials in that neuron, okay? Now that's how it works, but it also happens to be the case that for all of this to happen, it involves using a lot of energy. And so what the neurons need is they need glucose and oxygen so that they can actually implement this process. And so that's delivered via capillaries, via blood vessels near to the tissue. And so what happens is that when a part of the brain is, neurons are more active, there's an increase in blood flow, there's an increase in delivery of glucose and oxygen, and there's also an increase in consumption, okay? And so what we can do is we can put people into this machine called an MRI, and many of you may have experienced this if you go to the hospital to have your ankle imaged, if you have a fracture or so on. It's basically the same technology. We put people in here. It's a very large static field. The one on campus is 3 Tesla. And they go inside, and what we can do is when we give people tasks to do, and of course we assume that when they're doing particular tasks, some parts of the brain are more active than others. And what happens is a change in the amount of oxygenated to deoxygenated blood going to certain parts of the brain as a result of this neural activity. And that's basically what we measure, because that oxygenated and deoxygenated hemoglobin has different magnetic susceptibilities. And we can pick up those differences in the magnetic signatures in different regions as a function of the amount of oxygenated, deoxygenated blood that there is. So that's the trick that we're using to sort of have an indirect measure of neural activity. Okay, so let's get back to how we might actually look for signals like experienced utility in the brain. Okay, so imagine we have someone in the scanner. And this person is hungry, okay? So they haven't had their lunch. And what we do is we pump in odors, okay? So we pump in smells. So here is a banana odor, and so we pump in the smell of bananas. And we also pump in the smell of vanilla ice cream, okay? And we measure activity while they're smelling these odors. Next thing we do is we take people out of the scanner, and we feed them until they're absolutely stuffed with bananas, okay? Now, what's going on, apart from the fact that we're treating people like monkeys, is that after you've eaten a lot of bananas, even if you liked the smell of banana to begin with, the whole idea of a banana is probably going to become slightly aversive to you after you've eaten a lot. You say, I really don't want any more, and the pleasantness of this has gone down. Okay? So we have a manipulation for changing the pleasantness. So here, presumably, and we selected people to find banana pleasant, and here, after they've eaten all these bananas, the pleasantness has gone down, and we can then put them back in the scanner, and we can present the banana again and measure the activity, okay? Now, the other thing is that the pleasantness of the vanilla odor shouldn't decrease as much at all, if at all. And the reason is, it's because of a phenomenon called selective satiation, and I like to refer to this as a restaurant phenomenon. So imagine you go to a restaurant and you have a big plate of spaghetti, and you're absolutely satiated on this spaghetti, okay? The waiter comes around, it's one of those all-you-can-eat places, says, would you like more spaghetti? And you say, no, I don't want any more spaghetti. But supposing the waiter comes around with the dessert tray, what would you say then? Well, you might say, well, actually, I could do with some tiramisu. And so what selective satiation is that even if you eat a lot of one type of food, you might still find other kinds of foods pleasant. Okay? And that's advantageous because it means that you diversify the amount of the foods that you eat, which means you diversify the nutrients that you get. So it actually has an evolutionary reason. Okay, but it's very useful for us because we can also say, well, look, there's no change in pleasantness to this, and so we can look for selectively areas that are changing in pleasantness to the banana odor. Okay? And when we do that, this is just showing you areas of the brain. These are 5 different participants that are basically showing changes in the responses to the banana odor from pre to post feeding compared to the vanilla odor. Okay? And these blobs are regions of orbitofrontal cortex on here. Okay? And this just shows you the response. So there's basically a decrease in activity from pre to post satiety to the banana odor, but no such decrease to the vanilla odor. So what that suggests is that the pleasantness, which is the thing that's changing from pre to post for the banana, it might be represented in this region. Here's another example. So here they're playing a simple task where they have to choose between 2 fractal stimuli. And when they do that, depending on the choices they make, they get to win or lose money. Okay, so here this is actually in pounds. This work was done in the UK. And here they've made a choice and they just won 175 pounds. Okay? And they make different choices and they win or lose different amounts depending on the choices they make. And what we can do is just look for areas that correlate with the amount of money that they win or lose. One area in particular that shows a strong correlation is, again, this orbitofrontal ventromedial prefrontal cortex. So it's basically showing an increase in activity as a function of the amount they're winning. So if they win a lot of money, there's a big increase in signal, whereas if they win less, there's a smaller increase in signal, and actually if they lose, if anything, it's decreasing below baseline. Okay? So it's representing the amount that they're winning or losing, which could also be a measure of experience utility. Here's another example. So here, what we did is we put people in the scanner, and we presented different faces. And we didn't tell people what we were doing. We just asked people to judge the gender, whether the faces were male or female. But actually what we did is we manipulated the attractiveness of the faces. So we had some faces that were very high in attractiveness, The faces I'm showing you here are generally rated to be higher in attractiveness. And we also had some faces that are rated as low in attractiveness. I'm actually not showing you that here. I don't think it's fair to show people's faces and say they're low in attractiveness. But we did this, and what we did is we measured the activity again in the brain while we were doing it, and we found that a region again of medial orbital extending up into a medial prefrontal cortex was more active when people were watching attractive faces compared to unattractive faces, even though that wasn't even the task that we asked them to do, okay? So again, it suggests that even for a visual stimulus, some property of the rewarding aspects of that stimulus is encoded in this part of the brain, okay? So we've got some evidence that experience utility is represented in this region of VMPFC. So what about decision utility? Well, before we get to decision utility, we have to ask a question of how would you learn a decision utility for these options, okay? And let's imagine that, well, one way you would do it is that you would sample from the different options and you'd see what you get. So let's imagine that we're just sampling from these different slot machines and we're just plotting the outcomes that you got all, back in time from the jth time point all the way back, okay? And so you can see, so here we're just for simplicity's sake, we're just imagining this binary outcome. So it's either you win $1 or you win nothing. And you can sort of see that one of these slot machines, you're kind of winning more dollars than than on the other slot machines. So that might suggest to you that, taking this information into account, the past history, it gives you information about what you expect to get on the machine in the future, okay? And that's basically the trick that you're using. You're using information from the past, accumulating evidence from your past to make an inference about what you think things are going to be like in the future. And one way of doing that is by using a thing called a prediction error. And prediction error is just the degree of surprise you experience, okay? So more formally, it's the difference between what your experience utility actually is and what you expect it will be, i.e. your decision utility, okay? So let's just have an example of this here. So imagine this slot machine here, and we initially have this is your expectation. We initially have a very low expectation for the slot machine because we never saw it before, and so why should we expect anything of it? And then we select it, it spins, and lo and behold, we've won $1. Well, what's going to happen here is that this is going to be surprising. You didn't expect to win $1, and you just did. So there'll be a strong prediction error, okay? And that'll be used to update your expectation. So you'll update your expectation proportional to your prediction error. And then so you'll have a slightly higher expectation the next time you come along, and then you'll come along again, you'll choose the slot machine. Whoa, you've just won another $1, okay? This time you're a bit less surprised because you just won the last time, and your prediction error is a bit lower. Okay? And so you keep updating, and eventually you'll have a high expectation, assuming that this slot machine is paying out money every time you select. But then what happens is you might come along, and things might be going against you. So instead of winning, this time you've just lost, or not won anything. And what will happen then is that prediction error will be negative, because it's a negative surprise. You expected to win, and you didn't. And then that could update your expectation, and that would actually cause it to decrease. So this is a very flexible way. It's basically a mathematical algorithm that allows you to learn expectations by taking into account how surprised you are, okay? Now, why did I talk about this? The reason I mentioned it is because there's some evidence emerging to suggest that there a very specific set of neurons in the brain might be involved in representing this kind of surprise signal. So this is a slice through the middle of the brain. And deep down in an area called the midbrain are a collection of nuclei called the ventral tegmental area and substantia nigra, so basically just bundles of neurons. And they contain what's called dopamine neurons, so these neurons that use this neurotransmitter dopamine. And this is released, these neurons release this chemical into areas of the brain, including the prefrontal cortex, such as the VMPFC we've already talked about, as well as an area called the ventral striatum and ventral and dorsal striatum, which is part of the basal ganglia. That's also in the center of the brain here, okay? And the reason why people got excited about these neurons is from work that was originally done by a guy called Wolfram Schultz, who actually has a visiting position here at Caltech and comes here for 3 months of the year. And what he found, he was recording in animals, he found that these neurons had firing activity that looked like the sort of prediction error signals I've just talked about. So one of the questions that we had is, well, can we find evidence in the human brain for these kinds of signals while people are doing decision-making tasks? Okay. And so here is an example. So this is a four-armed bandit task, just like the kind of task I already talked about. They're selecting from one of these 4 slot machines. They get to win points, and they win different amounts of points depending on the machine they choose. So unbeknownst to the participant, for example, here, the amount of points they win changes over time. So for example, here, if they were to select the red slot machine, they'd win more points on average. And over here, if they selected the yellow slot machine, they'd win more points. And what the participant has to do is keep track of which machine is currently paying out the most and try to maximize the amount of reward that they can gain. Okay, so while they're doing this task, we're measuring their activity with fMRI. And we also use these mathematical operations using the prediction error signal to try to work out what their expectations are at every point in time while they're solving the task based on the outcomes that they previously experienced and the prediction errors that were generated. So we have predictions for each point of time. If this model were being implemented in the brain, what the signals would look like, what the activity would look like on a trial-by-trial basis over time as it varies. And we can look for both expected value at the time of choice, this decision utility, as well as looking for prediction errors when they get the outcomes. And this is just showing you from a bunch of studies where we find prediction error signals. This is a very, very robust result. And prediction errors are very robustly represented in an area that I mentioned before called the ventral striatum. And this is the area that receives the densest input from these dopamine neurons in the midbrain. So you see these signals sort of representing how surprised you are, the difference in your reward expectation versus what you actually experienced. Okay? And we think that that's important for enabling you to learn decision values, decision utilities. And then we can look for where the decision utility itself is represented. And here we find, once again, our old friend, the ventromedial prefrontal cortex. So this area is correlated with, at the time when you're making a choice, how much do you think a given option is going to give you reward or not. So the more you think a given option is going to give you a reward, the higher the activity here. And the less you think it's going to give you reward, the less the activity here. So it seems to be tracking your expectation and could be used to guide your choices. Okay, so one question you could ask. So far we've talked about this notion of utility maximization and the notion of encoding the value of goals and then learning to make predictions about what options are going to give you the highest chance of getting to those goals. And one question you could ask is human behavior always governed by considering the current utility of a particular goal? And actually, probably not. Sometimes we're probably creatures of habit. And here's an example. So I'm Irish, so this is a road in Ireland. And every year we have many, many tourists, a lot of people coming from the United States, a lot of people coming from elsewhere, in Europe and Japan and so on. And very often, of course, people are used to driving on the right-hand side of the road. But of course, in Ireland, the rule is that you drive on the left. And so you imagine you come out of the airport, you get your rental car, you're going left, 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 left. You're very careful. You drive to the restaurant. You come, you have a nice meal. I won't mention anything about alcohol. You come out, you face a road like this, and you go on the right, okay? And it's actually estimated that about 20% of accidents, road traffic accidents in Ireland involve a foreign person to some extent. Now, maybe some of those involve driving on the wrong side of the road, okay? Now, what's going on is that obviously, in a goal-directed, if you're thinking about this in a goal-directed way, you say, well, no way do I want to drive on the wrong side of the road, because it's dangerous. It could be fatal. So what's happening is you're doing this without thinking about the consequences. You're acting in a habitual way. So is there a way that we can study habits in the laboratory? Well, here's just another toy example. So imagine that I have a refrigerator in my house, which indeed I do. And every day I come to open my fridge door and I retrieve a cupcake. Okay, and I like cupcakes. nice cupcakes. And I do this many, many times. So I've learned, go to the fridge, open the fridge door, retrieve the cupcake. Then one day, I go a little bit crazy. I go out to a cafe, and I eat all these cupcakes, okay? So just like in the banana example, what's going to happen is that I shouldn't want to have any more cupcakes. I should find the value of cupcakes to be low, the utility of cupcakes to be low, and I just shouldn't want them anymore. So the big question is, what happens if I go back to my kitchen and I'm faced with my refrigerator? So the question is, do I open the door and try and retrieve the cupcake or not? And if I'm goal-directed, so if I'm thinking about the consequences of my actions, I'm thinking, well, if I open that door, I'll get the cupcake, and I don't want the cupcake, so I'm not going to open the door. Well, then I won't open the door. But if my behavior is being driven by a habit, what I might do is actually open the door and retrieve the cupcake anyway, okay? Even though I don't want it. And that's kind of the test that we can use in the lab. So here's an example task. So we had people in the fMRI scanner, and they're basically hungry again, and they're responding on one of 4 different actions, which are denoted by basically keys on a button box. So it's kind of like a little mini keyboard. So they're in the scanner, and in this context, they see this particular fractal, and they respond on the second button, and they just keep pressing it. Every now and then, they'll win M&Ms, okay? And those M&Ms, they don't eat them in the scanner, but they get to eat them outside, okay? And similarly, in this condition, they get to press another button and they get Fritos. And here, this is just a control where they don't get anything, okay? And critically, we followed some animal data that suggested that rats can become habitual in their behavior if they're overtrained on an action, okay? So they're learning a lot about one particular action and the consequence of that action. After a long period of time, they tend to become habitized. So we did the same kind of thing. So we had an undertrained group, and these guys got only 1 day of training, and they only had 2 8-minute sessions. It's a very easy task, so it doesn't take them long to learn, but they're essentially not overtrained. And then we have an overtrained group, which has 3 days of training, and they get 4 8-minute sessions each day. Again, it might not seem like a lot, but it is a very, very simple task, okay? And after we do the training, we take them out of the scanner and we feed them to satiety on either the M&Ms or the Fritos. And then we put them back in the scanner and see what they do. And the big question is, do they, for the action that's associated with the now devalued outcome, do they respond on that action anymore? And what we find is that the 1-day group actually do decrease the responses. So they stop responding to the action that's associated with the thing that's now been devalued. So if they've been fed on M&Ms, they won't choose the action as much that leads to the M&M outcome. But they still will choose the action that leads to the Fritos because of selective satiation. But the 3-day group are equally responsive on both. So it's as if they don't care anymore about the consequence of their actions, and essentially the behavior looks habitized. And then we can look in the brain and see, are there areas of the brain that are showing changes in activity as habits start to take hold? And the one area of the brain that we found very robustly to do this is a region called the posterior putamen, which is again in this a structure in the center of the brain called the basal ganglia. So basically activity here increases over time, over training, and by the end of day 3, it's much more active, significantly so than it was on day 1. And there's plenty of additional, this is the first data showing this, and we've got many, many additional studies showing that this area is involved in habits. And it also happens to correspond to an area in the rat brain that if you damage that bit of the brain, the rats cease to develop habits. Okay, so it seems to be kind of preserved across species. Okay, so we've identified the location of where we think habits might be implemented. So to conclude, we're beginning to understand how it is the brain learns from past experience and makes decisions for the future. And we've seen that it involves an interplay between a number of different brain systems, most prominently the ventromedial prefrontal cortex, but also the dopamine system and different parts of the basal ganglia. And we've also seen that there appear to be multiple systems, not just one system guiding behavior. There's a goal-directed system, which plans and thinks about the consequences of actions, as well as a more habitual system, which is much more reflexive, and these systems may depend on very distinct brain circuits. So why is this important? Why am I spending my time doing this? Well, one reason is that certain neurological and psychiatric diseases seem to involve dysfunction in some way in these brain circuits. And they also involve behaviorally alterations in decision-making. So an example would be depression. So depression clearly involves people making very different kinds of decisions than they would if they were not depressed. But it's also associated with abnormalities in some of these brain structures, including the ventromedial prefrontal cortex. So we know that there are structural changes in people that have very, very profound and intractable depression in this part of the brain, as well as other kinds of diseases. So, for example, obsessive-compulsive disorder or addiction to drugs of abuse. They seem to involve an over-engagement or over-egging of the habitual system. So it's as if they're performing actions, performing behaviors that are inherently very difficult to stop, they're very persistent, and they basically dominate behavior. So it's as if there's something going wrong in the balance between their goal-directed and habitual systems. So I think that the general idea is that if we can gain knowledge of how these circuits are working in the healthy brain, we can start to understand better how they might go wrong in people that have different kinds of disorders. And actually now we're getting to the point where we're starting to test people with different kinds of diseases and looking at how these circuits might be different in these diseases. And eventually, we hope that that might involve development of new treatment. So for example, could involve ways of stimulating the brain to change activation, or the development of better drugs targeted at particular brain systems, or even just smarter behavioral interventions. And I'd like to conclude by thanking all of the people in my lab and all my collaborators from elsewhere who have contributed to this work, and thank you for your time.
I wonder to what extent these experiments, particularly the ones where you're looking at goal-oriented decision-making, give us any clue as to where consciousness might be located and whether it is localized at all.
Okay, that's a great question. So you might think that aspects of goal-directed decision-making involve conscious awareness. So often if you're kind of planning things, maybe you're sort of consciously aware of the kinds of plans that you're retrieving. My view is that I view consciousness as a different problem. So there's no reason to assume that every aspect of what is goal-directed decision-making involves conscious control. And part of the reason for thinking that is that people often don't have very good insight into how they're making decisions, even if you ask them afterwards. They often tell you, well, I was doing this strategy, or I had this particular plan. And then if you look at their behavior, it actually doesn't track that very well. So I'm not really convinced that we're always consciously aware of how we're making our decisions. So I think that it's a very interesting problem. Consciousness, of course, is a very interesting problem, but it's not necessarily mapping directly onto goal-directed decision-making. But I think the more we understand about how the brain does make goal-directed decision-making, at least we could look within a subset of those circuits potentially to look for what role conscious awareness is playing.
So I think that you were trying to indicate in the last forward-looking statements that you're trying to make a distinction between normal behavior and abnormal behavior. And in my work in medical device, it has been a big challenge to understand mean and standard deviation and understand population sizes. So in your viewpoint, give us an idea of what sample size and what types of populations you would look for before making decisions about normal and abnormal. And take into context that some people have argued that mental health has been somewhat Western-centric. Yeah. And so normal has been defined in mental health by Western culture. Right, so perhaps that's too narrow a sample pool.
So, I guess my view actually is that what we're planning to do is to have a computational framework. So understanding of how the brain on an algorithmic level solves problems, okay? And clearly there are some situations where how it solves problems might be suboptimal. And there's other situations where there might be differences. So there might be differences in the parameter in the model, and it might just solve things differently. So, to some extent, we can be agnostic about what the borderline boundary is between abnormal and normal. What we're trying to do is parameterize differences, individual differences. And, clearly, in some cases, people who are, for example, if they're, having an addiction, they might view that as being something that's causing them personally distress. And then we can try and say, well, what is going on if we measure the different parameters as they're making decisions and look in these circuits? Is there anything different in these people that have this situation where something behavior is causing them distress, or for example, persistent drug taking or compulsive behavior? And can we see how that's different to people that don't report that kind of distress? So I think it's a very interesting question, what's normal, what's abnormal? But I think we can also just say we're not trying to make a dichotomy. We're not trying to make a sort of, you're abnormal, you're normal. We're just interested in what the variance is across the population. And are there relationships between that variance and behavioral phenotypes, such as, for example, kind of, having distress, having compulsive behavior? Yeah.
Two observations. In Ireland, in Japan, in North America, we all drive on the right side. It's just that in Japan and Ireland, the right side is on the left side. And our language causes some problems there.
True.
But I found as I came to the States or went back to Japan for the first 2 or 3 days, when I came to a corner, I had to make a decision. Do I do it there or there? But it took that training.
Yeah.
Now, interesting thing, I live now in Henderson, and I go to my Master Gardeners meetings about 5 miles away to the north. And in the past, I used to say, if the light is green, I push the gas. But if it's red, I take my foot off the throttle. But going in Las Vegas, I see a green light, I take my foot off the gas. If I see a red light, I put my foot on the gas. Because the signal is a half a mile or a mile away.
Right, yeah. So
I had new habits.
Right. I think that what you're saying is that there's all sorts of challenges because in different contexts, different behaviors are appropriate. So, you can also learn very contextually specific habits, and sometimes you also have to decide what habit needs to be applied in a given situation. Sure, yeah.
Yeah, on addiction, you seem to say it was habit being formed, but there are also other things going on, like the first taking of the drug or alcohol, whatever. You love it.
Yeah.
And
Yeah.
So there's a very strong utility there.
Oh, yeah.
And later on, when it's not working, something else is going on. I don't know what.
Okay, now that's a great point. So yes, it's definitely simplification. And you understand, when I'm giving a talk like this, I kind of have to make simplifications just to get, for the didactic purposes. But it's certainly true that in drugs of abuse, I think early on, because of the hedonic pleasure that's elicited by the drug, that's probably hijacking your goal-directed system. And so it's not just the habitual system. But I think the compulsive aspects, as you already alluded to, of the drug-taking behavior maybe probably depends on the habit system, which, as you say, becomes more manifest later on. So certainly if you want a comprehensive understanding of addiction, you have to understand not just the habit system, but also how it's hijacking and altering your goal-directed system. And even, in very long-addicted addicts, probably they are, often very creative. So, for example, if they decide to break into somebody's house to steal money for drugs, that's clearly a very goal-directed behavior. So it's even late on in addiction, the goal-directed system is involved. And so it's certainly more complicated than just a single story about habits. You're absolutely right.
I believe you said that the ventromedial prefrontal cortex is abnormal in depression.
Yeah.
Is that abnormal brain structure, abnormal brain activity, or a combination?
Both. So it's basically there is an atrophy in a decrease in the amount of tissue in people that have long-term depression, intractable depression in that region, and there's also changes, hypoactivity in that part of the brain too, functionally. And actually, one thing that this motivated work to do deep brain stimulation, so to implant electrodes very specifically in this part of the brain. And what happens is that actually can relieve intractable depression. So this is work that other people are doing on this, somebody called Helen Mayberg. Unfortunately, it's not permanent, so the effect seems to wear off, but there was a lot of excitement about that initially.
Does this seem to be a cause of the depression to the long term, or might it be, is it something that might have been earlier on and then there's the depression?
So I don't think we know. I mean, I think there's evidence to suggest that familials of depressives who aren't depressed themselves also have some abnormalities in this region. But it's often very difficult to separate out cause and effect, and that kind of takes a lot of work. Yeah.
I was really surprised to learn today in Professor Tsau's talk that when she was looking at perception, the part of the brain that responded to faces was completely different from bananas and apples, and even bananas were different from apples in terms of the monkeys wanting fruit. So I'm just wondering, in this type of study, when you're looking at decision making instead of perception, is it sensitive to the type of thing? So like a decision relative to a human or face would be different than a decision related to a apple or banana?
Right, that's a great question. And actually, we have done work on this. So one question that you might have is, if you're computing a utility, a value for something, is it the same if I'm computing the value, as you mentioned, of a banana? Is that the same as when I'm representing the value of a face? Okay, and we've actually done some work on that, and it seems like there is a part of the brain. So if I want to make a decision, say, between going to dinner versus going to the movies, okay, they're two very different kinds of goods, and so the idea would be that if you want to be able to make, if you're going to be able to make that decision, you have to have some common scale to represent the value of those goods. And we actually find there is a region, again in the ventromedial prefrontal cortex, that just represents the value of something, irrespective of whether it's a banana or whether it's a concert ticket or what. So we think that there's a kind of very general utility signal. But we also think that before that happens, before that gets integrated into a common value, there are unique signals for different kinds of goods. And we've actually shown that, for example, the value of food items within the VMPFC on the orbital surface, there's a very a posterior part that seems to represent the value of food, but not any other goods. And there's a more anterior part that represents the value of other kinds of consumer items. So there's definitely a topography, and we think that you get maybe value signals initially are assigned to unique categories of goods, and then they get integrated into a more general value signal for the purpose of making decisions. Yeah, so that's actually work we're actively doing.
Okay. You commented on the reduced activity and perhaps atrophy in the prefrontal cortex with depression. There's been efforts to use transcranial magnetic stimulation to try and counter that. Could you expand on that at all?
Yeah, so I guess it's, so the problem with TMS, transcranial magnetic stimulation, is that if you do it down here, because it's basically inducing, it's activating or disrupting activity in neurons, but it can also stimulate muscles, okay, or sort of nerves in the periphery. So if you do it down here, you actually end up stimulating eye muscles, and it's actually very painful. So you actually can't TMS down here. Where you can TMS is up in the more dorsal parts of the prefrontal cortex, and that's what a lot of the studies that you're referring to involve. And I think that the literature is very mixed in terms of how successful that's been, is my understanding. So a lot of people who've looked at effect sizes think, and I think it's still, the jury's out, think that these approaches have not been that successful as of yet. Now, there is another way of stimulating down here, which is with direct current stimulation, and which doesn't have the same side effect. That's sort of something that's kind of come online more recently, so I'm not sure how much data there is out there about how efficacious that is. So it seems that these kinds of stimulation techniques, at least for depression, may not have sort of enduring efficacy. But that's not to say that we might not be able to ensure that it does in the future if we understand better about the mechanisms. Thank you.